Welcome back to Long COVID Doctor, an educational series for all of you out there who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years. I'm now working in Long Covid Services for 5 years. I post on all the usual podcast channels as well as on YouTube. I hope you find them helpful, and if you do, click subscribe. Let's spread the word. Just to say, there's no conflict of interest here. I do these recordings, these postings for free. I'm not gaining anything financially. My reward is to help you get better. Thanks for all the feedback you send in. Apologies for no replies. I just haven't got the time. I wish I did. I read them though. I appreciate them. And please keep them coming because they actually help me with my future postings. Another apology is that my usual disclaimer, and that is it's important that anything that I mention in this or any of the other podcasts and YouTube postings should only be taken into consideration after you've talked to your own doctor, your own trusted physician on whether you should be embarking on a treatment or recommendation that I've made in these postings. Let's keep it safe. So, this talk is all about vagal nerve stimulation in long COVID. I will cover what vagal nerve stimulation is, how to use it, why we should be using it in long COVID. I'll talk about the evidence and the safety, and then the practical side of vagal nerve stimulation. So here we go. So first and foremost, what is vagal nerve stimulation? Well, basically, as it says, it is stimulation of the vagus nerve. It is the delivery of stimulation to the vagus nerve, either using an electrical signal and devices, or indeed you can stimulate the vagus nerve by simple breathing and physical techniques. Overall, the goal is to improve body regulation and healing. First and foremost, what is the vagus nerve? Well, basically, the vagus nerve is a really long nerve. It's an extremely long nerve connecting the body with the brain. It was first identified way back by a physician called Galen, who was the personal physician to a Roman emperor called Claudius in 200 AD. He called it the great nerve. The vagus nerve is the longest nerve in the body, and in the 1600s it was then named as the wandering nerve because it's the longest nerve in the body and it goes all over the body. So it wanders here and there. It's everywhere, around the body, from the brain, around the body. It is made up of 2 branches, each of them consisting of 100,000, approximately, nerve fibers. So the vagus nerve has 200,000 fibers. It is a 2-way highway link between the brain and the body. So from the body to the brain, 80% of those 200,000 fibers, 80% of those fibers are basically taking signals, sensory messages from the body up into the brain. So stretch stimuli. So when there's a stimulus such as stretching, stretching is picked up by receptors in the heart and the blood vessels and the lungs, and they send signals up to the brain. Chemical stimuli are picked up by receptors around the body, and they detect pain and temperature and sugar levels and inflammation and oxygen level and carbon dioxide level. So those receptors pick up those chemical signals and send impulses up to the brain. But that's only 80%. What about the other 20% of the vagus nerve? Well, the other 20% of the vagus nerve, that 20% of those fibers, are basically sending impulses from the brain down to the body. And these are action messages, action impulses to the heart, to the lungs, to the respiratory tissues, to the gut, and to the immune system. So therefore, what does it do? Well, basically, the vagus nerve controls heart rate. It slows it down. It controls breathing. It slows it down. It controls digestion, the process of enzyme secretions in your digestive tract, but also the contraction and relaxation of the muscles that push food through your guts. And finally, it controls the immune system. It has an anti-inflammatory effect. Basically, the vagus nerve is the key part of the parasympathetic nervous system, the rest and digest and rest and repair nervous system. Stimulation of the vagus nerve will activate all those processes to the heart, the breathing, the digestion, and the immune system. So why are we considering vagal nerve stimulation in long COVID? Well, think about it. Many of the underlying causes of long COVID include autonomic dysfunction. So dysfunction of the autonomic nervous system. That is responsible for a number of the long COVID symptoms. Persistent inflammation, again, responsible for a number of some would say most of the most of the symptoms of long COVID. So vagal nerve stimulation will help address those problems, the dysautonomia as well as the persisting inflammation. So therefore, that's why we consider vagal nerve stimulation in long COVID. Stimulation of the vagus nerve is going to be a good thing because it's going to address excessive inflammation. It's going to go towards addressing inflammation, but also go towards addressing dysautonomia. What are the mechanisms behind vagal nerve stimulation? Well, there are three main mechanisms. So there's the first mechanism is the vagal nerve stimulation brings about rebalancing of the nervous system. So improved vagal activity equals improved vagal tone, which equals increased parasympathetic activity, reduction of the fight-flight sympathetic overactivity. So this helps with heart rate regulation. It helps with that sort of fear-panic response of the sympathetic nervous system. It helps with stress resilience. If you've got good vagal tone, you've got good stress resilience. That's really handy in long COVID recovery. So that's the first, rebalancing of the nervous system. The second is its anti-inflammatory effect. Vagal tone, good vagal tone, vagal activity reduces pro-inflammatory cytokines. So the cytokines such as interleukin-6 and TNF-alpha are reduced by strong vagal tone. So therefore, that's going to help this calming this chronic inflammation of long COVID. And then the third mechanism, pain-reducing effects of vagal nerve stimulation. So basically, pain-reducing effects. It reduces pain pathways in the brain. An activated vagus, the vagus nerve being activated, reduces those pain pathways in the brain. And it also reduces pain central sensitization processes. Central sensitization is, if you like, the phenomenon of the nerves misbehaving, doing something that they're not meant to be doing, firing when they're not meant to be firing. So central sensitization is dampened down by the strong vagal nerve activity. That basically means that pain of long COVID, and we know that lots of our patients complain of pain, be it generalized or localized, limbs or centrally. That pain, that chronic pain of long COVID, will be reduced. I'm not saying it's going to be eliminated, but it will dampen it down. That's a good thing. So, all in all, sounds like vagal nerve stimulation is a very good thing for our long COVID patients. What's the backstory? Where did it all come from? How did it all come about? What's the history of vagal nerve stimulation? Well, basically, it was developed in the 1980s, when devices were surgically implanted that fired off, implanted and attached to the left branch of the vagus. Remember what I've said? The vagus nerve starts in the brain and comes down, and then it divides into two, goes down what's known as the carotid sheath. I'll come on to that, but basically either side of the neck. And in the 80s, remembering that, they were quite familiar with implanting electrical devices to control the heart, namely pacemakers. Okay, so we were familiar with that. So they started experimenting with implanting other things, other devices to give off electrical stimulation. And they hooked it up with the left side, the left branch of the vagus nerve, for treatment of, this is 1987, drug-resistant epilepsy. And then in 2005, it was used for treatment of treatment-resistant depression. Also for migraine and cluster headaches. So, and there is evidence that actually it's effective also in inflammatory diseases, fibromyalgia, and, interestingly enough, ME/CFS. This obviously got people thinking. If there's evidence that it's effective in fibromyalgia, which is those painful conditions of muscles here, there, and everywhere, and helpful for symptoms of ME/CFS, it may be helpful in long COVID. That's how it all started. That's how it was introduced into long COVID. Okay, so how we've established that actually stimulating the vagus nerve is a good thing because it stimulates the reparative process, the immune system, and the sort of the autonomic side of things, and those pain pathways. So it's a good thing. We need to look into this. How are we going to do this? It has been looked into. There have been some studies in long COVID, but on those other conditions I've just highlighted. But how are we going to do it? Well, we can look at it like the invasive and non-invasive. So I've talked about the invasive for the drug-resistant, treatment-resistant epilepsy and depression. Those are invasive, where it's implanted. Let's put those to one side. Let's think of the non-invasive ways to stimulate the vagus nerve. And I'm going to break that up into two: the non-invasive strategies and the non-invasive devices. So let's focus on the strategies first of all. Well, the first and most commonly realized and used strategy is breathing exercises. Slow, deep, diaphragmatic breathing, such as in yoga breathing or mindfulness or meditation, brings about deep diaphragmatic breathing brings about natural variation in the heart rate during that respiratory cycle, i.e., variation in the sense of the interval between the heartbeats varies. And that variability of the heart rate is otherwise known as the vagal tone. So it's a measure of vagal activity. So breathing changes your heart rate. Interesting. During inhalation, the deep breath in, the vagus nerve activity is lowered, it decreases, and your heart rate speeds up. During exhalation, breathing out, the vagal activity increases, your heart rate slows. So normal respiratory cycle, breathing in, breathing out, your heart rate speeds up, slows down, speeds up, slows down. And that, with an electrical tracing of the heart, the ECG, is seen as heart rate variability because the gap between those heartbeats either increases or decreases. Increases, no, that's the variability. A good variability, high variability, equals high vagal tone, which is high parasympathetic tone, which is related to high sort of stress resilience. So that's a good thing. So breathing is a non-invasive strategy to stimulate your vagus nerve. Other non-invasive strategies are cold exposure, so face immersion in a basin full of cold water, or if you are brave enough, while swimming in cold water, will bring about what's known as the dive reflex. Temperature and pain receptors on your face send immediate messages to the brain to conserve oxygen and energy, and activates the parasympathetic nervous system, a calming effect. While swimming, why not try it? I love it. Twice a week only. And then another non-invasive strategy is humming and singing. Sounds good. And sounds strange. How can that be? How can humming and singing stimulate your vagus nerve? How? Well, wait for it. It's all down to the anatomy. The vagus nerve passes behind the throat and vocal cords. When you sing, hum, physical vibrations, they singing and hum bring about physical vibrations in that area, and they massage and, if you like, activate the laryngeal branch of the vagus nerve. So the vagus nerve, as I've said, starts up here and ends in the gut and beyond, throughout the body. Lots of branches here, there, and everywhere. One of the branches is the laryngeal branch around the larynx. Okay, larynx, got it. So a branch of the vagus nerve, as the vagus is going down, sends off a couple of little branches to the larynx. If you hum and sing, that causes vibration and massages and activates that little branch of the vagus nerve, and then that sends if that's activated, it will activate the rest of the vagus nerve. Okay, so I've covered the non-invasive strategies, emphasis on strategies, humming, singing, mindfulness, meditation, yoga, breathing, exercises. They're strategies. What about the devices? Like I said, I'm not going to talk about the surgically inserted devices. I'm talking about, that's the invasive. I'm talking about the non-invasive, externally applied devices. There are two main types. First of all, applied to the ear, and secondly, applied to the neck. So the ear, you've got the ear clip stimulators that stimulate the auricular branch of the vagus nerve. So it's another branch of the vagus nerve, but this is around the ear. And then there's the handheld neck device that stimulates the cervical branch of the vagus nerve. So it's another branch of the vagus nerve, cervical. So you've learned three now: the auricular, cervical, and just a minute ago with the humming and singing, the auricular branch, the laryngeal branch. So let's look at those devices in turn. First of all, the auricular vagal nerve stimulation device. Like I said, its function is to stimulate that branch of the vagus nerve, the auricular branch. It's the only branch actually on the surface of the skin, the only branch of the vagus nerve throughout the body that is actually on the skin. And it is located in the ear. And there are two main areas that we use these devices on. First of all, the cymba concha of the ear, which is just above the ear hole. Okay? Just above, sort of like a crescent just above the ear hole, where most of the auricular fibers are to be found. The other area that we apply the auricular vagus nerve stimulator device is the tragus, this sort of rubbery bit of soft tissue. It's got a bit of cartilage in it, the tragus, just in front of the ear hole. Ear hole, otherwise known as the external auditory meatus, if you will. It also has auricular fibers of the vagus nerve. Basically, the device is placed, depends on which device you get, one for the concha, cymba concha, or the other for the tragus. Mild electrical pulses stimulate those auricular branches of the vagus. The vagus picks it up, takes it up to the brain, into the autonomic, if you like, the autonomic areas of the brain. And there's research, it's backed up by research. It's used in lots of different conditions, and consequently, those conditions have been researched. So groups of patients with epilepsy have noted benefits, depression, anxiety, post-traumatic stress disorder, brain fog, pain, inflammation, autonomic dysfunction. So all these conditions have been researched, clinical trials, and patients have been treated with them and asked what the outcome is. And those patients and those studies have validated its use in those conditions. So examples of what devices can you get? So basically, there's something you can get online called, there are the three big main popular ones are NeuroStim, VaguStim, and XEN. NeuroStim, basically clinically validated, and they say you should use it for 30-60 minutes, once or twice daily. Aim for about 60 minutes totally per day. And VaguStim and XEN obviously will have their treatment protocol also. Auricular vagal nerve stimulation also can be prescribed. It's regulated, it's evidence, and there are a couple. NeuroStim, which has basically a license for irritable bowel syndrome in adolescence. And the Sparrow system has a license for relief of opioid withdrawal symptoms. It's a much higher voltage, but yes, it is validated and has a license. They both have licenses for those specific conditions. Not long COVID, okay, but the manufacturer has the license for those conditions. So that's the auricular vagal nerve stimulation. What about the cervical vagal nerve stimulation? Basically, the vagus nerve travels from the brain. It divides into the two halves. Remember I said there are two branches of the vagus nerve. Each has got 100,000 fibers in them. And they travel down from the brain stem down into the body, down what's known as the carotid sheath. Okay, which is basically a tube of fibrous tissue, I'm going to say, which contains the common carotid artery, the internal jugular vein, as well as the vagus nerve. So it travels down wherever you feel your carotid pulse. That's the carotid pulse. So therefore, that's where the internal jugular is, and that's where your vagus is. So it goes down into the chest cavity. So the vagal nerve stimulator is applied to the carotid sheath. So the vagus, to locate it, you obviously locate the carotid pulse, and that's where the vagus is running along the carotid artery. So basically applying that cervical vagal nerve stimulator is over that area. You're stimulating the cervical branch of the vagus nerve. Don't get confused now, because if you Google cervical nerve, you may come up with the cervical sympathetic chain, which runs down the either side of the backbone. Okay. That's not what we're talking about here. We're talking about the cervical branch of the vagus nerve here. So, basically, this has been approved for migraine and cluster headaches and an adjunct for depression and epilepsy. One thing to be clarified. When I'm talking about the cervical branch, I'm talking about the cervical segment of the vagus nerve. It's not one specific. It's like I talked about the auricular branch of the vagus nerve. I talked about the laryngeal branch of the vagus nerve. They're actual sort of, if you like, side shoots. What we're talking about is the section of the vagus nerve in that cervical area. This is the cervical area of the neck. This is the lower down is the thoracic. Lower down still is the lumbar. But this is the cervical stretch of the vagus nerve. So you're actually putting the device on the vagus nerve. Got it? You can get vagal nerve stimulators online, of course. You can get everything online, can't you? The three biggies are Truvaga Plus, the Pulsetto, and VE Relief Prime. You can also get the vagal nerve stimulator as a prescription, but again, it is nice recommended and has a license for treatment of migraines and cluster headaches. Not, I emphasize, not for long COVID. So if you go to your doctor and say, I'd like a vagal nerve stimulator called GammaCore. GammaCore is the device that's got the license. If you say, I'd like it for my long COVID, the doctor will say, sorry, can't do that because it's off license and I can't provide that prescription I can't provide it on prescription. If you have cluster headaches, yes, definitely. So gammaCore is if you like, the accepted nice device as recommended by NHS approved for treatment on those nice guidelines. The reason I'm saying this is that gammaCore thought to itself, the makers of gammaCore said, actually, I want a piece of the action. Wouldn't it be nice if we could be able to have a device using our technology, etc., that you can get online? And so they did. So that's when they brought out TruVega, the first of the three that I mentioned above, which is basically, like I said, using the same mechanics and wavelengths and what have you, the technical side, but a lower voltage than gammaCore. So what are the side effects of vagal nerve stimulation? Obviously, any intervention, any treatment, we should always ask ourselves, are there any side effects? We've got to be aware of potential side effects before you embark on anything. Basically, vagal nerve stimulation is very well tolerated. The good thing is it's non-invasive and has a good safety profile. If there are side effects, they're usually mild and temporary. Some people say that they can get a bit of skin irritation or tingling and discomfort. Some people can get headaches or dizziness. Rarely, you can get voice changes because of that neck stimulation. And remember the good old laryngeal branch of the vagus nerve may be stimulated, but rare, very rare. What are the risks and contraindications for vagal nerve stimulation? Well, anyone with a pacemaker or implanted device shouldn't be using it. Serious heart rhythm disorders, you shouldn't be using it because you're interfering with the heart rate, aren't you? So epilepsy, yes, it's used, but you shouldn't go and buy yourself, if you've got epilepsy, you shouldn't buy yourself a vagal nerve stimulator and have a go, mate. No, you need to be discussing it with a neurologist. Pregnancy, you shouldn't really use it because really limited data. Let's just be safe on this one. I think the take-home message always is, medical advice first. So let's think now about the practical side. How's it used? Well, for neck, you should use it for like 2 minutes and twice daily. For the ear, you could use it for 60 minutes once daily or 30 minutes morning and evening. It's up to you. It should be comfortable, not painful. If it's uncomfortable and it's painful, you shouldn't be using it. I think when you start using it, the sensible thing to do is start slow, go low, or start slow, and maybe just instead of 2 minutes on the neck, use it for 30 seconds and twice daily for a couple of weeks, get used to it, etc., and then slowly increase it. For the ear, maybe 15, 20 minutes twice a day and get used to it. And then you can increase it to those sort of recommended lengths of usage. Evidence in long COVID? Well, early studies and case series show that there's improved fatigue and better heart rate control and reduced inflammatory markers. But, these studies are small and few. And so we need, obviously, bigger studies. What are our patients telling us when they use vagal nerve stimulation? Well, I think first and foremost, it's not going to necessarily be a guarantee for everyone. Some people will use it and they note no difference. They don't feel any better. Or their long COVID symptoms are unchanged. So there'll be a group of those patients. However, there are a group of patients who do notice an improvement in their fatigue and their brain fog. Some people say that they're having less palpitations, maybe because of that parasympathetic, increasing the parasympathetic, rebalancing of the autonomic nervous system. Some people feel less anxious and their sleep problems are better. Some people find that they're getting less pain. When patients use it, they sometimes say that they have a mild tingling or pulsing feeling when they apply the device. Some people get mild sort of contraction of muscles, especially in the neck. So not especially in the neck devices. Some people say that there's a sort of warm buzzing sensation. People say that, they've noticed those who do notice an improvement, notice it within days and weeks. Others say, I do notice an improvement, but it's taken about 3 months to get better. So what are the key takeaways? Well, the vagal nerve tone can be improved with simple breathing exercises and incorporated with mindfulness and yoga. Maybe cold swimming if you're feeling brave, that dive reflex. Humming and singing, that was quite, during the pandemic, the ENO were offering these breathing, these singing classes. There's benefits, not only because of the social contact for the singing, etc., but, vagal nerve stimulation as well. Wow, pretty good. The benefits of vagal nerve stimulation are due to its effects on the autonomic nervous system, its effect on inflammation, and its pain-suppressing effects. So, these are the mechanisms that underpin underpin vagal nerve stimulation. And the devices, ear and neck, non-invasive therapy, I would encourage that. And they're safe and evidence-based and generally well tolerated. But like everything in long COVID, it's a matter of incorporating whatever you're introducing as a new strategy or device. You should use it alongside of everything else that you're doing to try and improve your long COVID. So thinking about that more holistic, general approaches, looking at exercise, looking at diet, looking at sleep, looking at reducing stress, etc. So incorporating it with all those other strategies. So there we are, vagal nerve stimulation. I hope you found that helpful. And like I said, if in doubt, ask your doctor whether you should go for it or not. Safety first. And, as I said also, if you found this helpful, spread the word and click subscribe and all the rest. Let's get this information out there. And there are a lot of people who are still suffering from their long COVID. And wouldn't it be lovely if this information is more widely picked up and can be used to help you actually get over that long COVID and recover from the scourge that it is. So until my next posting, I wish you well and look after yourselves. Cheerio now. Goodbye.